Very pleased to say the Health Secretary, Matt Hancock, joins us once again on the programme. Minister, great to see you this morning. And look, we are all in need of a bit of a pick-me-up these days. So let's start with the good news. And there really is some good news around this morning. The information released yesterday about the efficacy of the Oxford vaccine, combined with that research from UK Biobank today about antibodies. I mean, taken all together, does this mean, Mr Hancock, that you and I are going to be enjoying a summer holiday this year? Not together, I should point out.
Well, who knows? I very much hope so. This Oxford report is very good news. It backs the strategy that we've taken, and it shows the world that the Oxford vaccine works effectively. And the really good news embedded in it is that it not just reduces hospitalizations. There were no people in this part of the trial who were hospitalized with COVID after getting the Oxford jab, but also it reduces the number of people who have COVID at all, even asymptomatically, by around 2/3. And so that reduction in transmission, as well as the the fact there's no hospitalizations, the combination of that is very good news. And it categorically supports the strategy that we've been taking of having a 12-week gap between the doses, because it shows that the strength of the protection you get is in fact slightly enhanced by a 12-week gap between the doses. So it's good news all round.
Good news, and indeed, and taken together, let's just reflect for a moment on the antibody research, the fact that you could possess some level of natural immunity if you've had COVID-19 for as much as 6 months. I'm being slightly cheeky in referring to the summer holiday that everyone so desperately wants, but all of this taken together, it does feel like we might be moving in the direction of being able to plan that far ahead.
Well, the vaccine has always been the way out of this, and we've backed them from the start because they can give that immunity without having to have the disease. So yes, of course, the existence of antibodies for 6 months after you've had the disease is good protection for people like me who've had it. But of course, we want people to get protection without having to have the disease, and that's what the vaccines are all about. There's one other thing that's really important in this, which is that we linked up this vaccine trial with the testing system to ensure that you could test people every week after they'd had the vaccine or the placebo in the trial. That's why we know that the Oxford vaccine reduces your likelihood of getting COVID, whether symptomatic or not. And it's the only trial that has made that test and made that link, because we linked it to NHS test and trace from the start of the trial. So, this shows British science working extremely well, linked up with the NHS and the government effort. And it means that people right around the world can be confident in this Oxford vaccine, and I'm very, very pleased about that.
What though of the Pfizer vaccine, particularly as regards the South African variant? Lab tests in Cambridge suggesting that one only has enough protection after a second dose. That will be of concern, presumably, given that we have been rolling out Pfizer here.
Well, the fact that there is some protection from the variant first found in South Africa, that itself is good news. There was a fear that the vaccines wouldn't work at all against that variant, whereas there does appear to be some protection.
Sure, but there is a need in the research. It does suggest that you do need that second dose to kind of approach the levels of efficacy that we want to see.
Well, of course, against these new variants, we may well need boosters that are of a slightly adjusted vaccine as well, in the same way that we do for flu each year. And we're working with the companies on that, on developing those, and then on ensuring that they can get regulated and they can be safely used much more quickly than first time around, because it's an adjustment to the vaccine rather than a completely new vaccine like these ones. So that is an important piece of work. But the core piece of work is to vaccinate people against the virus that is at large right across the country now,
Of course.
that we need to protect people from.
Still, though, there will be people who are concerned this morning when they wake up and read the news that the Kent variant, the British, the homegrown variant, does appear to have acquired that E484K mutation, which so in essence, we have a variant in the country at the moment that has both increased transmissibility and greater resistance to the vaccine. I mean, should we be concerned about that?
Well, we've seen a very small number of cases of this new mutation of concern, but it is absolutely critical that where we find them, we absolutely stamp on it. And the actions that we've taken to put in the enhanced contact tracing, the extra testing in the whole community around where we find a case, and the clear instructions to people in those areas that it is imperative that they stay at home and avoid all contact with other people outside their household wherever possible. That is important. In a national lockdown, we will be able to tackle this, but it does require, as all social distancing requires, it requires a team effort from all of us.
It does. But just on that point, on the team effort, because of course it involves the public, but it also involves the government, be it local or be it national. In terms of the financial support, I mean, we're asking people in places like Woking to not go out to the shops, in essence, if you've got food in the cupboards. As things stand, 70% of people who are applying for financial help to self-isolate have been denied it. 1 in 4. In fact, in 1 in 4 council areas, that figure rises to 90% of all applications being rejected. What is going on here? I mean, it strikes me it's one of two options. Either, the English public is committing fraud on a massive scale, or the system's knackered and it just doesn't work.
No, neither of those are true. What's happening is that we're targeting the support at those who need it most. So we've got a clear eligibility for the £500 payment. And if you are in receipt of benefits because you're low paid, then you will be able to get that support.
So we should expect to see figures of 70% rejection in local authorities. That was kind of within your modelling. That's what you expected to see.
Well, it depends who's applying, Neil. But I know what's working because I've obviously looked into this. And local councils are making the decision to ensure that it is that those who are low paid who get the support. And making sure that we target support to the right places has always been a very important part of any government's plan to support people. So the financial support is there, the testing is there in very large scale, and crucially, because we built this big genomic sequencing capability, we can spot new variants, and we can then take the action that's needed.
Can we talk for a moment about the measures that are being taken at our borders? Sage advised the government about a couple of weeks ago that if we wanted to come as close as possible to removing the risk of new variants arriving here in the UK, there are two things you could do: close the borders or mandatory quarantine. The government did not choose to do that. Can you explain why the government didn't follow that particular piece of advice?
Well, again, you've got that wrong, I'm afraid. The government brought in mandatory self-isolation for every passenger coming into this country. We used to, as you'll remember last summer, we used to have the travel corridors. So some countries that you could travel to, travel back from, and not have to isolate. We changed the law, and now you have to isolate wherever you've come from. Now, of course, we're looking always to strengthen protections further, but we brought in those protections on the basis of this advice.
Yeah, 10,000 people, roughly, perhaps, are arriving here in the UK every day through our airports. It was a week ago that we were first told that quarantine hotels were on the way. When are we going to have them?
Well, obviously, we're working on these proposals. That's specifically from red list countries. You're not at the moment allowed to travel direct from red list countries at all.
But the key word is direct, though, isn't it, Health Secretary? I had a quick look online this morning. If I want to fly from Johannesburg to London, it costs me £300. I can do it today, and I fly via Doha.
And you have to isolate, and that is a legal requirement, and we have enhanced enforcement against that. So I think that, of course, we're always looking to strengthen these things, but we already have very stringent measures in place at the border.
You say that we have very stringent measures in place in the border. As things stand, we've spoken to Border Force, we've spoken to the union representing them on this programme before now. As things stand, by their reckoning, all you need to do is have a fairly professional bit of paper in your hand saying, I have tested negative for COVID-19 within the past 72 hours. And in terms of self-isolation, yeah, great, many people will do it. A lot of others won't.
Well, it is a criminal offence to lie to the Border Force. And so, it's always a challenge in government to ensure compliance with the rules. The truth is there are stringent measures in place at the border. It's a criminal offence if you do exactly what you just described.
Sure.
However, we are also looking to strengthen measures, in particular from those countries that have the highest risk. And work is underway to develop that. So, protecting people with strong action at the border is absolutely necessary. So too is the lockdown at home, unfortunately, to make sure we get this virus under control.
Sure.
But the good news is we can see our path out, and the data that we've had published, that we've seen published last night, reinforces the fact that the strategy that we're taking is the right one to get us out of this safely.
But Health Secretary, just as things stand, with the controls that we have at the border, with no date, and there was no date from you as to when those quarantine hotels will be in place, isn't it the case that there is a possibility that a new, potentially dangerous variant could arrive here in the United Kingdom, bypassing all of the security that you've just mentioned?
Well, of course, in a country that like Britain, making sure that we protect at the border is a challenge, but is important. And hence, we've put in place the very stringent measures that we've got, and we're putting in place further measures.
But I'm sorry to repeat the question, but no one, I'm not asking for a guarantee, because no one can guarantee. But absent those measures that SAGE recommended, mandatory quarantine, or just a closing of the border.
The reason this is a slightly odd exchange is that you keep reading out that SAGE wanted mandatory isolation for those who have arrived, and that's what we've got. Now, I'm up for strengthening that further, and we're looking at that. But we do work very closely with these scientists, and they are brilliant at working with uncertainty, because epidemiology is an uncertain science, and there's a lot of.
When will we have the hotels? When will we have the quarantine hotels?
Well, that'll be set out shortly. But the critical thing is the measures are already in place to require the isolation of every single passenger who comes into this country. Now, further enforcement of that, of course, can always be introduced and strengthened. But the advice is clear that everybody coming in should isolate, and we removed the travel corridors where there was no isolation. So this idea that you're trying to propose that there hasn't been action at the border is completely wrong.
I'm certainly not doing that, Minister. But thanks for your time this morning.